Congratulations, you've decided to move forward with an ongoing health ministry. It is one of the most rewarding outreach efforts that any congregation can pursue. This DVD will take you through the steps to establish a health ministry, reach the people who need it most, and maintain success. You can pause the DVD anytime you'd like by clicking the pause button on the screen. If you exit the DVD, remember where you stopped so that when you return, you can click on that heading in the main menu and easily return to that section. And as always, anytime you have questions about establishing a health ministry, please contact the Tennessee Department of Health Faith-Based Initiative, where you can get all the answers and assistance.
A deeper belief in living a healthy lifestyle. A higher purpose by honoring God's temple. A stronger commitment to living as God intends.
If Jesus came, we would have an abundant life. But how can you have an abundant life and with high blood pressure and blind from diabetes and on dialysis?
So how can I help my people have the abundant life that Jesus came for? I do that with a spiritual diet, preaching and teaching, but I also have to be concerned about the physical and emotional process of the people as well.
It is possible to have a more abundant life because you are the power in the pews. This step-by-step video will illustrate how faith beliefs can lead to healthy actions, offer a cure for congregations that want to start health ministries, and give specific tips to start work immediately. The Tennessee Department of Health has a solution for many of the health problems affecting African American and Hispanic communities. In essence, the faith-based initiative offers a cure for congregations that desire a change and want to start a health ministry.
When we began with the C in C.U.R.E, we're talking about contact, making the right contact in the congregation.
The number one thing I look at is the need. I knew that there was a need in our congregation to do something about our health.
To sustain a health ministry, first of all, it's important to get the leader of that organization, which would be the pastor, in tune to the fact there is a need to do this.
I then presented the program, outlined it to the leadership here at the congregation, to our elders. They looked at it and they said, okay, we will agree for you to do a pilot program.
Once the leadership has signed off on the idea, he or she appoints a health ministry coordinator.
Most churches have some health professionals, be it nurses, be it medical assistants, be it physicians, or other people that are interested in health care. Obviously, if you can recruit from within, you have to have that fire, that passion from within.
This person is the direct link between the congregation and the health team at the church, sharing information within both groups.
You just need one person who would take responsibility to put information in a bulletin or do a bulletin board. It does not take an entire group of folks to do it. It doesn't take a lot of time.
Many church leaders across the state have already taken the lead in educating their congregations and fully support the state's efforts. They're encouraging members to embrace healthier lifestyles.
We try to educate from the pulpit on how to make and keep goals for regaining health and maintaining a healthy body.
You can't praise God, you can't serve God or service the people of the Lord if you're in ill health. You have to be well.
I know that Jesus is the mountain.
The church is regarded as the cornerstone in many African American and Hispanic communities. These congregations understand the communities and their concerns.
We want to give churches tools where they can assess what the health needs are. Once we understand what the health needs are, then we can design a program.
When the health ministry first started here, what we wanted to do was to kind of assess our congregant body. And we did a preliminary survey to kind of determine and gauge what they had envisioned in terms of health ministry at the church would mean for them.
One of the girls has said they'd like us to start a 5-minute exercise class. Another one said, let's bring in a recipe every week. Well, you know, that's something I never thought of. And that is really what it's about. Not one person has all the ideas to any ministry or any program for it to be successful.
One church has a lot of elderly people in their congregation, so we're focusing on chair exercises for that group.
Start to our left and then to our right. Let's go.
They just kind of customize it like they would a vacation Bible school, depending on the needs for that congregation and that church.
One of our congregations in a rural setting has a weight Bible study. They come together on Monday night. They read the scriptures, they weigh in. When I visited that group, they had lost about 500 pounds collectively.
I do believe that it would be a great idea to incorporate blood pressure screenings and even blood glucose screenings in a women's day program and a men's day program, for instance.
Another practical tip is to use what you have. Health ministries don't have to be complicated programs.
We just ask members of the church, all of those exercisers and walkers and steppers that they had made into expensive coat hangers at home, to give them to us, and they did.
Members of Schrader Lane Church of Christ in Nashville created their own fitness room. Even the perimeter, just outside their sanctuary, has become an indoor walking track.
The convenience of the walking is on campus has made it a draw for many members that are on their lunch hour or maybe before they go to work.
Now members can work out together and worship together. There are numerous projects congregations can undertake. A Memphis church published its own cookbook featuring healthy takes on Southern favorites. Also keep in mind the various age groups that make up your congregation.
We saw a poison frog.
Be sure to include events for children that will engage them, like this poison prevention demonstration.
Oh, touch the rattle, touch the rattle.
Relationships are the most important part of this. Trust is part of the relationships. We want people to be able to trust us.
If we need to find a contact person, to find an expert, we can call you and say, hey, we need someone to talk about cancer or diabetes or AIDS. We don't have to search high and low.
There are health departments in every county with staff that are ready to help you plan your health event.
We work with a group called Puertas Abiertas, and that is opening doors to the Hispanic community. And so it's making those partnerships with your minority coalitions or your minority communities.
Most Hispanic people are very shy about giving information and letting people invade the space. But once they see that Hispanics are working for Hispanics, they open up and they know that they have to try to participate.
One organization in Memphis also reaches out to churches interested in launching health ministries.
Congregational health promoters are people that come to our facility for 8 weeks on a Tuesday night to learn about specific health issues. Now, we don't make doctors and nurses out of these people, but we talk about practical things.
The primary relationship in any health ministry is the one between a church health ministry team and the congregants. Relationships are the key factor that keep a program going year after year, generation after generation.
If you did not protect privacy, people would not feel comfortable coming to you. They would not disclose truthfully what their health issues and concerns are, and our efforts to address their real health needs would really be undermined.
Sometimes I have to give them our phone numbers, and that way they can call us and get the help they need.
The trust factor there is there, the familiarity is there, and it's done in a group. That gives you more confidence when it's just not you. There are other people around.
Periodically they'll say, are you on your meds? Are you taking them the same time every day? Are you taking them the way the doctor prescribed them? I say, yeah, girls, okay, I'm on it, I'm on it.
Developing relationships will help your health ministry grow. As it grows, it's very important to monitor the program's progress.
The E is for an evaluation, evaluating the work that has been done in the health ministry or health event.
We have monthly meetings. The first Wednesday of each month, we come together as a team and we talk about what our plan is moving forward. We talk about the things that we've accomplished. We look at what our strengths and weaknesses are.
A sample survey is available on the Tennessee Department of Health's website. It will help you track your health ministry's progress. Evaluations can be as simple as members reporting results from weight loss, screenings, or attendance at events.
My pilot program started January of this year with 7 women. And in 10 weeks, the 7 women lost 57 pounds. Our last program, out of 17, we had 107 pounds lost.
We had a men's health workshop in September of last year, and we had about 70 men. And out of the 70, we had prostate screenings. And out of the 70 men, we had 3 that had elevated blood levels. Of course, if they hadn't had the screenings, they would have never known.
A woman who lost 100 pounds, losing a whole person, and she's better. We get reports of people's blood pressure has gone down. It's become manageable. I think that makes a great impact.
Be sure to celebrate every success. Sharing the good news will motivate and encourage participation. Plan an event that highlights healthy lifestyle choices.
Churches, for some reason, tend to get into bad habits, believing that it's a sign of fellowship and affluence. There's almost nothing that goes on at a church but what a chicken leg is not right in the middle of it with gravy on top of it, and we eat. And it's just as much fun to walk together. It's just as much fun to do other things together.
Faith is the cornerstone of good health. That is the foundation that really helps us to understand that with the knowledge of prevention, the faith keeps us going.
If we take the strengths of the faith community and the strengths of the health department and form a team, a partnership, we can reduce health disparities in the state of Tennessee.
The Tennessee Department of Health and Faith-Based Initiative is committed to being the bridge between African American and Hispanic communities and good health. Beginning a health ministry, tracking the improvement in your members' health, and celebrating your successes are all part of the cure for helping to heal communities. With your church's involvement, the battle against critical minority health issues can be won.
An ailing army cannot fight. And if we're going to be in the army for the Lord, if we're going to seize and take back enemy territory, if we're going to be the strongest spiritual soldiers that we can be, then we have to be in good shape. We have to be healthy.
Now that you have all the information you need for starting a health ministry, remember you are not in this alone. The state of Tennessee has many resources designed to help you have a successful ministry. The work you do will help to eliminate the major health disparities in this state. It will change lives and energize communities. Just think, a year from now, you could be looking at a healthier, livelier, and more productive congregation and community. You have the power, and the power is in the pews.